Hello, everyone. Hello, everyone. Okay, I think we have sound now. Hello, everyone. We are going to be talking about the treatment of male sexual dysfunction, specifically erectile dysfunction, which is abbreviated as ED. So let's just jump right into it. Forgot to silence my cell phone again, so that's sorry about that. All right. So treatment of male sexual dysfunction. I'm going to keep it professional, by the way. Try to keep the jokes as a minimum. Don't want to get in trouble for anything that I think is funny and other people don't. So, anyways, let's keep it professional, everybody. Introduction. This is a very common disorder for your male patients, young and old. Typically, it is going to be more of an older male problem, but it can happen as young as a teenager, 18 years old, specifically the premature ejaculation, which is abbreviated PE. So this is something that you may be encountering with any of your male patients. Well, any of your young adult / adult male patients. This is a pediatric issue. So definitely going to read through these and just know the different definitions. Like I said, mainly we're going to be talking about the ED, which is erectile dysfunction. We've talked about ejaculatory dysfunction before as far as it being a side effect of some medications. So definitely something to be mindful of when you're prescribing medications or where there's polypharmacy involved, meaning a male patient is on a number of different medications. And then also to know that these dysfunctions can decrease libido, erectile dysfunction, ejaculatory dysfunction can exist altogether, or maybe it's just one thing, maybe it's another issue, it can be a grab bag, etc. So, and it can be up to a third of adult men that can be affected. And it says distressing here. It is very distressing. Your male patients may be reluctant to talk about it. There are cultural and stigmas and some kind of, personal feelings that men don't, want to admit or maybe may not want to seek out help for or advice for. But so it's definitely something that is good to ask your patients about. So this is a note here that they've found that health professionals should therefore ask men of all ages about sexual dysfunction as part of their routine psychosocial assessment. So just to highlight that there, when you are out on rotations and out in practice, it is something that you need to be thinking about, be mindful of. You don't have to be pushy about it. You don't have to, grill a person every time or, anyways, you guys will start learning about that, like the art of patient interviews and stuff when you guys get out there. It also, too, is going to be something that can be part of your patients who have hypertension, ischemic heart disease, diabetes mellitus. They can unfortunately be something that says kind of you can think of as a side effect of some of those diseases. And then, like I said, too, especially with an older man who has had hypertension and diabetes for a longer period of time, that is something that you need to be thinking about, or that may come up in your clinic. Also, ED can also be seen commonly in men who undergo radical prostatectomy. Got to make sure I slow down and say that properly. For prostate cancer, so that's something unfortunate side effect of that as well. Like I said, we're mainly going to be focusing on erectile dysfunctions because of the medications that you guys will be able to prescribe for this disorder. So definitely, when you first, assess the patient, or the patient comes to you and they're concerned about this, you need to look at their medications they're on. So you remember we've talked about the beta blockers and how the beta blockers, so you can go and highlight that. The beta blockers are a big culprit for the erectile dysfunction, sexual dysfunction. Historically, they were thought to be a bigger problem with erectile dysfunction and basically, long story short, there's been more research done, and they're not as big of a threat, I guess is the best way to say it. They're not as big of a cause as they once thought. However, it can still happen, and with some of the other antihypertensive agents, and also some of the antidepressant agents, which we'll talk about in the psychiatric module. And then you also have to remember too, if a person's on antihypertensive medications, they have hypertension, right? So the hypertension, the disease itself, can also lead to erectile dysfunction. So anyway, so just be mindful of that. One of the strategies with the antidepressants is that they sometimes will add a second antidepressant. Don't stress too much about that for this module and for studying purposes for this exam, but that will be more relevant with the psychiatric module. So that's just more of an FYI bullet point right now for this module. And then you definitely need to look at if there's a medication you can change, you can maybe, reduce it, or if the person can lose weight, or if they can reduce their hypertension. Those are things that can happen. I mean, that can help, and then they can happen as far as, your patients can lose weight, especially too, again, not unprofessionally, this isn't that big of a unprofessional joke, but men will be highly motivated to maybe make some of these lifestyle modifications if they are having sexual dysfunction. So the joke goes, and my wife says this all the time, that men only go to the doctor when something's wrong with their penis or whatever, so because in general, women go to the doctor more than men. And so your male patients will be maybe highly motivated to do some of these lifestyle modifications. For example, quitting smoking, losing weight, maybe reducing their hypertension. If you explain to them and kind of educate them that this could help with their erectile dysfunction. So here's some etiologies of erectile dysfunction. Just going to read through these. It's just mainly, this is an FYI table, but just right here, let's go and highlight drug-induced for my course, of course. Be thinking about the drugs and that some of these things can cause erectile dysfunction. And note here too that recreational drugs, so this is something that you will be coming across. And recreational drugs just basically mean, the illegal substances people sometimes abuse, cocaine, some of these other medications that, doing too much of these recreational drugs, ecstasy, MDMA, Molly, whatever, can cause sexual dysfunction, erectile dysfunction. Excessive drinking too is another one. It's not, I don't know if this is on there or not, but, they might have male patients who complain, and it may be related to just their alcohol consumption. So again, something that they can maybe modify to help them with their erectile dysfunction or sexual dysfunction. So anyway, so read through this. This may be beneficial. I believe this will be beneficial. Don't quote me on it, but I believe this will be beneficial for your ICM exam and ICM course. But as always, please check with that professor to see if that's something you're responsible for studying. For my course, we are responsible for medical therapy, right? So definitely first line, definitely drugs. I'm all about the drugs, right? So definitely pay attention to these and studies for my exam. Pretty easy. I know students don't like me to say that, but relatively straightforward, relatively easy. I'm going to say it. You know what? Forget it. I'm saying it. No, for erectile dysfunction, it's basically one class of drugs we're going to be worried about and prescribing. The first line drugs, they are the PDE5, the phosphodiesterase 5 inhibitors. They're efficacious. They're pretty easy to use. Pretty well tolerated as far as adverse effects, which we'll talk about here in a little bit. And the men like them. They report that they work well, and they kind of have the results, desirable results is the best way to say it. So anyways, we have a list here, so definitely make sure you know and study the generic. I'm going to put the brand names here in a little bit just because the brand names are what patients and other providers usually refer to these as. So sildenafil here is the first one that was developed. You guys may recognize it by its brand name, Viagra. So I would argue that there's international recognition of the brand name Viagra. It was really a game changer. It was huge, both domestically and internationally, for men. And so most people still, even though this is generic now, the sildenafil, most people still, refer to it as Viagra. So they all appear to be equally effective. And so it's just going to be one of those things where we're going to look at like cost, side effects, drug interactions, and the patient's preference as far as, and we'll go through this. There's some little things here as far as duration of action, etc. One thing to note, and you're going to hear this 3 or 4 times during this presentation, going to put a star back by here. These PDE5 inhibitors are contraindicated in men taking nitrates. And then they also should be used cautiously with, you'll remember from the BPH lecture, if you've listened to that. If not, go back and listen to that BPH now. Whatever, you can listen to these in any order you want. But the alpha adrenergic blockers are a BPH medication, which you'll see there. So these alpha blockers need to be used in caution because there's a drug interaction. Basically, PDE5 inhibitors with alpha blockers cause increased risk of hypotension. So, and I talk about that ad nauseum in the BPH lecture. So go ahead and refer to that if you want a little bit more information on that. But definitely put a star by that. I want you guys to know that for testing purposes. And then also for, real life purposes too, right? So you notice here, first line therapy, put a star there. Please know the oral by mouth PDE5 inhibitors. So that's gonna be pretty nice. The second line and third line, still read through it and still, look at it for my exam, but I'm not going to be testing you guys, for example, on the vacuum pumps, the penile implants, or corrective vascular surgery. Again, those may be testable material for your ICM course. Please check with that professor. But for me, just stick to the drugs for this presentation. So you guys probably know my style by now, as far as I do these little lectures that are on little corners of healthcare. And so with these smaller lectures, just please focus on the medications, and then definitely focus on anything I say. Study, star, no, this will be on the exam. Anything like that, I would study. So lifestyle changes, like I mentioned, this may actually be a population that is motivated to do the lifestyle changes, to say the least. They may be highly motivated. So again, just anecdotal evidence, just my experience in the pharmacy has been that men have been very motivated. So they, in the sense that I worked in a lipid clinic as a clinical pharmacist, and, you get people to try to do lifestyle changes to lower their lipids, or, lower their cholesterol, and, kind of drag their feet, not really excited about it. But, when it's come to erectile dysfunction, as far as my experience, men have been very, enthusiastic, I guess is the best way to say it. So, weight loss, physical activity, it's like, hey, eat less, move more, quit smoking. So another reason not to smoke too, to encourage your patients not to smoke tobacco, especially your male patients who are interested in sexual activity. This will be another reason for them to stop smoking. And here we go. Here's the list. So please make sure you are studying these lists, the entire list. And like I said, please make sure you know the generic name for exam purposes. However, the brand name is going to be, this is one of those class of drugs where I feel like I rarely, almost never hear generic from physicians, other practitioners, nurses, etc., patients. And there's still ads. I just was watching TV last night, and there was still the Cialis ads with the 2 bathtubs, which I don't get that, by the way. I've had a student ask me about that. And it was a funny student, so I think he was just trying to give me a hard time and make me blush in front of the class. But the Cialis ad, so those brand name ads are out there, and so I think a lot of people have that. It definitely is that brand name recognition. It's like, people say like Coca-Cola or whatever, it's like a brand name recognition. So even the older ones like Viagra, like I said, that was the first one. It is available generic, not genetically, generic, and so it is cheaper. This is gonna be cheap. Oops, sorry. And then the newest one down here, is the Stendra, which is the newest one, and this one is going to be a more expensive one, just because it is not, there's not a generic available. Next table here, there's a lot going on, but please zoom up on this slide. Make sure you look at it. Let me see if I can zoom in on it. Okay, sorry, my computer's not working for me. So look at this table. I just messed up with the pausing thing, so hopefully this video isn't too weird and choppy, so my apologies. But yeah, so definitely please put a big star on this table. Make sure you please study this. We have the medications in the first column here. Mechanism of action and clinical use, please look at that. Adverse effects and precautions, put a big star there too. It's the contraindications there that we talked about with the nitrates, and then other precautions that, to look at. Drug interactions, definitely with these medications. This is going to be a class of one of those medications. We've talked about warfarin in the past. We've talked about phenytoin, I believe. We've talked about some of these medications. Well, these PDE5 inhibitors, these erectile dysfunction medications specifically, they do need to be worried about drug interactions. We already talked about the alpha blockers, the BPH medication, plus these medications causing hypotension, right? But there are some other ones you need to be concerned with. And be mindful of with taking my exam, your board exams, and with your patients. The good news with the drug interactions, if there is such a thing, I guess, I'm taking a positive, the glass is half full, right? Taking a positive outlook on life. The good news is with the drug interactions is that you can usually kind of mitigate them, in the sense that these PDE5 inhibitors aren't typically taken every day consistently. So it's more of a PRN usually prescription. So a common prescription we'll get is in the pharmacy is like Cialis, quantity 5 or 10 or something, and it's take PRN, take as needed basically. And the patient knows when they need it or whatever, you know what I mean? You don't have to be explicit about it on your prescriptions. You don't need to draw any pictures on your prescriptions. The patients know as needed what it means, these adult males. But so usually these drug interactions can be mitigated that way, as far as, maybe hold the dose of something if there is a real bad drug interaction. So usually not that big of a deal, but definitely for testing purposes, I want you guys to know the drug interactions, and specifically, like I mentioned, and I keep mentioning, the alpha blockers plus these PDE5 inhibitors, drug interaction hypotension, right? You'll notice the dosing here on the end. You read through it. As always with my exams, you're not going to be required to memorize these dosages. You also notice a couple other therapies at the bottom here. These are not first line, second line, or third line, or I guess they're kind of like second, third line. It's going to kind of depend on the patient. You'll notice an herbal product here that's over the counter that is popular and popularly requested. Men are interested in not having to talk about their sexual dysfunction. So a lot of your patients, or again, in my experience in the pharmacy, there are a lot of male patients that come to the pharmacy looking for herbal, natural supplements. They sell them at pharmacies, but they also sell them at gas stations too. I don't know if you guys have ever paid attention to the medications at the gas station. And before you guys ask, it's not because I'm buying them for myself, because I also had a funny student in the past ask me that, like, so how, what have you gotten at the gas station? And it's like, haha, all right, make me blush in class. Very funny. If, as a pharmacist, I like to see what is available at non-pharmacies. The other thing is too, my in-laws owned a gas station for a long time. They've now since retired and moved back to Nepal, but they had a gas station forever, and a cigarette store, and they had some different small businesses. And so that's another reason too. Okay, students, I'm not here out there again, but so there was things like horny goat weed. There was these other, male extends, and all these other ones that you could get at the gas station even. So definitely something to be thinking about. But as far as textbook medicine, not that the patient's probably already come to you, they've already taken it. So don't scold them about it, don't yell at them about it or whatever, but just encourage them to take your prescription medications instead. Because as like with the horny goat weed and some of these other products, they're not regulated by the FDA. So what's in there? And then I'm trying not to laugh here, but what is horny goat weed anyways? But yeah, so they'll have these different blends and stuff, like, proprietary blends of different herbals, different kinds. Some have been studied, and it's just basically, there's maybe some evidence that some are effective, but at the end of the day, they're not regulated by the FDA. So you need to make sure that the patient's getting a good source. So again, nothing against my in-laws. They had a gas station, but I wouldn't recommend them to go to that gas station and get some of these male enhancement products that are over the counter. So, and then there's been some other ones too, and there's like commercials, and you guys, we could probably, if we were in person, probably go talk about all about this. And like I said, if there's any students like I had last year, that you guys would ask me a lot of questions. I got a lot of questions last year about this. But the other one you'll notice here is trazodone. It's a antidepressant, which we'll talk about more in the psych module. Don't just look at it and know it's another agent, but definitely don't think of it as a first line or even second line. It is just something, and sometimes antidepressants can cause sexual dysfunction. So it's one of those that's, you should be kind of on the fence about prescribing. Definitely if someone needs an antidepressant and they have erectile dysfunction, trazodone may be your first choice, right? Because there's the rationale there that you could prescribe the trazodone with erectile dysfunction, because it may have some benefit or be beneficial. We talked about the bupropion earlier too. That may be another antidepressant, but don't stress too much about those. In the past, I've had students, because I don't give a lot of information here, and so I've had students in the past ask me, what else do we need to know about bupropion? What else do we need to know about trazodone, the Ohimbe or whatever? And it's, just what's on here in the slides. Don't worry about digging deeper and kind of, we will see those antidepressants again more in detail. So stay tuned for that. Going back to the phosphodiesterase 5 inhibitors, this is basically what they're doing. I mean, like I said, that other table, please look in the mechanism of action, etc. And then one note too, that they need sufficient environmental and psychological cues. So the person, what that just basically means is, right time, right environment. So note on here too, so you will have patients that are prescribed these, they take it maybe one time and they get frustrated it didn't work. And so basically what you need to do, the strategy there is to go back to that patient, or, they'll revisit that patient and let them know that, taking it just one time isn't an adequate kind of test if it's going to work or not. The patient may be frustrated, whatever, but, just educate them and say, hey, were you in the right environment? What was what was going on basically? Did you have sufficient sexual cues, etc.? And then encourage them to take the phosphodiesterase 5 inhibitor a few more times, to kind of retest the medication. Because with this erectile dysfunction, like I said, there are cultural stigma, or there can be psychogenic causes. So, and what that basically means is that there's kind of a mental block. A mental block to the proper sexual function. And so they, maybe, so basically it's, if you're too stressed out, you're too anxious, you're too worked up, you're not going to have, proper erection, even with these medications and stuff. And so definitely, encourage the patient to keep trying the medication before you just discontinue it and then give a penile implant, or discontinue it. And, so anyway, so yeah, please note that for testing purposes, that I had students in the past ask me about that. And it is like board style question, exam type of question. I do want you guys to be thinking about strategies sometimes when sometimes these medications fail, and specifically with this one, because you get frustrated men in the pharmacy that, wow, this thing doesn't work for me. Like there's, whatever. And it's not necessarily a sexist thing, but sometimes being a male pharmacist, there's been male patients that have felt more comfortable talking with me in the counseling section, in the pharmacy, when that little counseling booth or whatever. Sometimes we have a room where we can counsel patients. I've had men in there that are frustrated because they've taken it once or maybe even twice, and I just encourage them to make sure they're taking it properly, first of all, because we'll note later on there are some some drug interactions, and there are some food interactions as well. So some of these need to be taken on empty stomach and stuff. So just make sure the patient's taking it properly is the first step, and then I always encourage them to take it 5 times, take it and to not give up on it, and then also to try to encourage them to not beat themselves up about it mentally. Choice of drug, like I said, they're all going to be equally efficacious. However, it's going to come down to patient's preference, the cost of the medication. Do they have insurance? Are they a cash payer? Ease of use, desired duration of action. So some of these have a longer duration of action, and then the adverse effects. The sildenafil has the longest safety record, and that is Viagra, because it is the oldest. So as far as, textbook, as far as adverse effects, etc., that is something that, so it has some other limitations we'll talk about here in a little bit, but that may be something to start with. Again, if it's a cash paying patient, and if, they're concerned about adverse effects or whatever. So, and then again, please note, nitrates are contraindicated, to put a star by that. The other thing to consider is the onset of action. So how quick is it going to work? Can you take it right before you want to have sexual activity? So that may also be a reason why a person may prefer the newer Stendra, or the ODT is oral disintegrating tablet. So if you guys want to go ahead and write that there's a oral disintegrating. So the oral disintegrating tablet and then the Stendra can be taken 30 minutes before sexual activity. So that may be advantageous. And then the duration of action too. So how long do they want it to be efficacious for? So this Cialis here can be effective of 36 hours after dosing. So that may be something that, again, if a man wants to take it, in the morning time, let's say when he's going to go out for the weekend or something and get a date or something, it might be something. Again, it's going to depend on the patient. There's a lot of hypotheticals I could go through right now. But, just again, patient specific, what is it going to, what is that person? And then if the daily low dose Cialis can eliminate the concerns of onset and duration of action. And the other thing too to remember here, that this Cialis is FDA approved for BPH. So again, if you haven't listened to my BPH lecture, go back to that one. But the tadalafil is generic for Cialis. It's the only one of these medications that has FDA approval for BPH and erectile dysfunction. So, and the way I remember that is because of their ads. They have 2 bathtubs in their ads, with the man in one bathtub and a woman in the other. If you haven't seen those ads, check it out. Probably NSFW, not safe for work. So I wouldn't look at those ads with little kids or whatever. But so in one bathtub you have erectile dysfunction, the other bathtub you have BPH. I guess I don't know. I don't know if that helps you guys remember it or not, but that's the way I remember. The Cialis has both, and so that's another reason too why the daily low dose will be administered. So it's, again, one of those board style questions, 2 for 1. The person has BPH, they have erectile dysfunction, and they're interested in kind of spontaneously having sex whenever. Then and they like to kind of live free with that and not be restricted as far as having to wait 60 minutes or having to wait 30 minutes because it may kill the mood or whatever. That may be a reason to go with this Cialis. So again, choice of drugs really going to be patient specific. Another thing too that men don't like sometimes is these two medications, sildenafil and vardenafil, have to be taken on empty stomachs. So like I said, food interactions are concerned here. High fat meals and alcohol delay absorption. So again, if you're thinking kind of stereotypical date night, have a steak with some beer or wine or something, it's going to affect these medications. So another reason why some men don't like these two medications. And also another instance too, when you're counseling the patient, they come back, it didn't work, and they're on the sildenafil, and it's like, what happened? Well, I went on a date with my lady or whatever, and I don't know what people call their the girlfriend, and they had a steak and they had 2 beers or whatever, and then it didn't work. Well, it's like, well, the high fat meal and the alcohol can delay absorption, so that may have affected your timing, and then the whole 60-minute thing we talked about before as far as onset of action. So that may be an issue where the Cialis and then the Stendra, the newer one, they can be taken with or without food. So that may also be a reason or a rationale. So with my exam questions, I will make them clear cut as far as I won't leave you guys guessing. I'll have very specific questions. And so if I'm telling you to pick the best medication for the male patient with sexual dysfunction, for example, it won't be that tricky. And if it is or whatever, let me know, because I'm not trying to make it tricky. So I'll try to make it as straightforward as possible and make it clear cut. So let's say if there's a person who drinks every day and, loves high fat meals, which medications, and I'll put, tadalafil as an example, because you don't have to be worried about food or interactions or whatever. So, or if a person has BPH and ED, then the tadalafil, right? Rationale there. So hopefully that'll be good for you guys. There are some cardiovascular effects that you do need to be concerned with. So they can lower blood pressure and interact with nitrates, which I said, contraindication with nitrates, and then the hypotension is a concern. So again, stereotypically, older men, erectile dysfunction, hypertension, they may be on other antihypertensives, and so becoming hypotensive may not be a good idea for that patient. There's a note here that the most of the research has been done on the Viagra, the sildenafil, because it is the oldest. However, for studying purposes, exam purposes, and real life purposes, these cardiovascular effects, the contraindication with nitrates, and the hypotension, please put for all of the medications you are studying in the class as far as PDE5 inhibitors are concerned. Contraindication again. So here I've hopefully made the point, and no one's going to miss this exam question. Hint, hint on the exam. Put a big star on this slide. And if anyone misses it, I don't know what slide number this is. If anyone misses that question, I'm going to tell you guys to go back to this one. But anyways. So yeah, please put a star by here. Please make sure you know this. Key points include, definitely look at that. And because it's just one of those questions, I've come across this exam question in some of these board reviews for the PA boards. And I've had exam questions that are over this subject, and it seems like every year students struggle with it. So I'm going to be really put 3 star. I don't know how many stars you want to put on this slide. Bedazzle this slide. No, but yeah, so please make sure, guaranteed test question. And the point is, it's not that I'm trying to, trick you guys or anything, but I just, in the past, there's been issues with this topic and these questions I have about the contraindications with PDE5 inhibitors. So I'm hoping this year it'll be better. And because in the past, I wasn't trying to be tricky. I thought it was a straightforward question. So tweak the question some, but hopefully it will be good for you guys. And like I said, take home point, contraindications are important to know for real life, for my exam, and for your board exam. So, and most importantly, real life, right? Common side effects, definitely know these as well. Do want you to know these. Similar side effect profiles: flushing, headaches, dyspepsia, and nasal congestion. It's going to depend on the man as far as whether or not these are bothersome or not. So I've had some patients in the pharmacy report these, but then be like, it's not that big a deal. And then other men have to stop the medication. Maybe they want to try something else. They want to try one with a different duration of action, etc. So, but for all of the medications, all of the PDE5 inhibitors, you can go ahead and list these as common side effects. One adverse effect that is unique is with Viagra. And so Viagra, I don't know if you guys have ever seen it or whatever, but it is a blue tablet. And the reason I mention that is it may help you remember. It has this rare but serious blue vision adverse effect that is only associated with the sildenafil. So that is something to note as far as it being unique for that medication. And it is a reason to stop the medication and then to start the patient on another PDE5 inhibitor. So the blue vision has not been reported with the other 3 agents. Hearing loss is something, again, rare but serious. They're not really sure exactly what's going on, but it is something, again, rare but serious. So please note that. Drug interactions. So we already talked about this a little bit, but please refer to this table. Please go ahead and read through this, look at those. And like I mentioned, the big one is the alpha blockers plus PDE5 inhibitors equals hypotension. There's a little bit of math for you, right? Pharmacy math, quick math. 2 plus 2 is 4. No, I won't do that in my impersonation. But yeah, quick math there. Alpha 5 inhibitors and the PDE5 inhibitors equal hypotension. Second line therapies. So this is where you're going to get into your vacuum erection devices, penile injections, and vasodilating agents. There's also intraurethral alprostadil, second line therapy. But first of the second line is the vacuum device because it's non-invasive, less expensive. And so this is, I have an image of it later. But so the second line therapies here, we have the penile self-injection, intraurethral prostadil. So this is basically a suppository that the man inserts into their penis. And here you can read about those here. Just note for studying purposes for my exam, the vacuum pump will not be studied, or you don't have to study for my exam. It may be for ICM, I'm not sure. And then this last one down here is not available in the US, so don't worry about that. So just look at these two, the penile injection alprostadil and the suppository alprostadil, which is an intraurethral pellet, which I've had students ask me about that in the past because it sounds painful, I think, is why there was a male student who asked me about it. But it's a suppository and it's supposed to be gentle and stuff, but it's just going to depend on your patient as far as if they like it or not. And then there are some adverse effects and stuff. But anyways, this is an example of the pump, the vacuum constrictor device, just in case you've never seen one before. It's just FYI for my exam. Penile self-injection, and this is the one right here. Penile injection is 2 different brand names there. They have alprostadil plus papaverine. Don't stress too much about looking up these drugs and finding out more about them. Just, and this is how they inject it, a 90-degree angle. Priapism, that is something that you have to be concerned with these medications, these second-line therapies. It can happen too with the first line, but it's rare. If it does happen, the drug of choice here, please note, is phenylephrine. So DOC means drug of choice, not Department of Corrections, which is sometimes I've had people ask me that, but it's drug of choice plus PO by mouth analgesics as needed. So anyway, so just go ahead and read through this as well, and then we have the intraurethral. So yeah, the penile pain and bleeding is wise, and men don't like sticking suppositories in their penises. Those are reasons where, and the injection as well. I don't know. I haven't surveyed men, but there's been up to date. It says that men don't like injecting their penises, but that so anyways, that could be also a limitation. But again, it's going to depend on the patient, and like if the PDE5 inhibitors don't work or they're contraindication, they can't, and they just this is the only thing that works. They'll try it. And then third line, we have surgical options, which is just FYI for my course. It may be in ICM, you might have to study for, but this is basically where they do a penile implant, and they have some different ones, but the one that I've seen is on Up to Date, everybody. Get your giggles out. No, is where it's like a pump thing, and they have so you have a pump in your near your testicles, and you basically pump it up. Like you remember the Reebok shoes? No, it's not like the Reebok shoes, but it's kind of similar to that. But it's just basically you pump it up as needed. So some recommendations. Go ahead and read through those. And there is a evaluation of erectile dysfunction chart here too. This is just FYI for my exam. This may be beneficial in ICM, but don't worry about studying this for me. Summary recommendations, again, go ahead and read through that. That is it for this presentation. Thank you guys for your time and attention. As always, I appreciate it. Hopefully I kept it professional and didn't offend anybody or whatever. And so my apologies if anything was inappropriate. But please email me if you have any questions or comments or feedback. And that is it for today. I'll talk to you guys later. Bye.